Good morning, ladies and gentlemen. Welcome to our side event, Addressing Substance Use Disorder in Crisis Settings. I'm happy to be your moderator for today's event. Today, we will be exploring different ways to address substance use disorders in different humanitarian contexts. We will have 5 valuable speakers who will share with us their perspective over the 50 minutes. I'm not sure that we will have time for questions, so you can use the chat box for your question, and available speaker can answer to the chat box. So now let's start with our first speaker, Aslı Soysal from Dünya Doktorları, Médecins du Monde, Türkiye. Aslı, the floor is yours. Your microphone is closed, Aslı. You can, yes. Thank you very much. It's closed already, yes. You can open now.
Now
okay.
it's that solved.
Yes.
Okay. So sorry. Then let's begin again. And so sorry. And good morning, everyone.
Good morning.
My name is Aslı Soysal, and I have been working at Médecins du Monde Türkiye, DDD, Dünya Doktorları Derneği, as a Turkey field coordinator. Today, I'm very happy. We will discussing the preventive role of humanitarian actors in crisis settings, especially focusing on how they can address the increasing of substance use as a coping mechanism. We have observed a rise and, of course, increase in substance use during war, disasters, conflicts, economic hardship, and other crises. My presentation will explore how humanitarian actors can play a proactive role in mitigating this issue. I look forward to sharing my experience and opening the floor. And maybe if we got a time, we can discuss afterwards. Thank you. And I will wait a little bit because of Wi-Fi. Maybe we can have some. Okay, so sorry. Yes. I have some issues. It's
no problem.
No problem. Just a moment. I have some issues, but I can understand what's happening. Okay, no worries. There is one missing part, but no importance. I will explain.
Okay. Yes,
this is an operation map of MdM networks, and DDD, Dünya Doktorları, is also an independent member of International Médecins du Monde network as a 17 chapters. And in Turkey, we are working such vulnerable area in Hatay, Istanbul, Manisa, and Izmir. These are the most crowded area as the vulnerable seasonal workers, Syrian, Afghanian, and most of them it's coming from fear of the war, and they are living with these intolerable conditions in this area. And we have some, of course, some prevention activities as a humanitarian actor, and we support them access the healthcare system, mental health support, protective support, sexual and reproductive health support, and of course we have also helped them to social inclusion in life. And as it's mentioned in vulnerability in humanitarian setting, World Drugs Report is the combination of absence of protective factors in a greater exposure to risk factors that make person vulnerable to substance use. In the picture, you can see that you have enough protective factors. You are in positive physical, social, and mental, but the more you will have risk factors, you will become more vulnerable substance use initiation, and then harmful use, and finally substance use disorders. And we can say in humanitarian settings, population are generally more vulnerable to substance use because of they are more exposed to risk factors. They are coming from conflict of war, homeless, they are refugee status, even then they don't have any status in Turkey. Social exclusion, they are alone, they are feared to do, they are trauma, and they are afraid of the living with those communities, and of course it causes a mental health problem also. We have also observed this is a different humanitarian field where we are working, and you will see in the next slides, and I will share more experiences area at the field. This is the first slide of our observation from the field, Izmir and Manisa. In the seasonal agricultural worker camps of Manisa and Izmir, we can see a lot of these risk factors for substance use. These seasonal workers, agricultural workers in Manisa and Izmir, are coming from Syria and Afghanistan, and a lot of them come from conflict of areas, so they are already exposed to traumatic events. As they are refugees, they do not have a proper legal status, so they have very limited access to healthcare and other services also. They live in informal shelters or tents, so they are also excluded from the society. They are feared to living with them, with host community. Within one of our projects, we did a survey in 2022, and this survey seems confirming the vulnerability of these refugees to those risk factors. Regarding the survey, 20% of the response indicated that there has been a used substance in their surrounding, and the cannabis is the most commonly used substance in this area. And the other area from the field, we are now in Hatay at the pictures, and Hatay, of course, after the earthquake, we can see lots of risk factors that make a population vulnerable to substance use. In the devastating 6th February earthquake, thousands of people have lost everything, their family, their friends, and their home, their jobs, their hope, everything. And this is a big collective trauma. Then a lot of them have developed mental health problems because of challenging living condition and the uncertainty of their future. They are still living in temporary housing, containers or tent, an official tent area, 1 years after the earthquake, and they still have a limited access to healthcare and of course the other services also. Also, we did the same focus group discussion with our field staff in Hatay, and this focus group discussion seems confirming a rise in substance use and substance use disorder, especially to cope up with post-earthquake stress and trauma. And now the other slides from the field in Syria. DDD also operating a cross-border operation in Syria, in Aleppo, Idlib, and Afrin. In Syria, there is a combined complication at risk factor with the effect of war and the, of course, 6th February earthquake. The protracted war and have caused millions of IDPs and against traumatized population. People live in camp excluded from the society. They have challenging living conditions with limited access to everything, and they have a mental health problems. The focus group discussion we did with our field staff in Syria also confirmed a rise in substance use and substance use disorders. And regarding the study conducted by the Assistance Coordination Unit ACU in March 2022, 26% of response reported that the spread of narcotic substance has become a severe phenomenon in Syria. And maybe it's time to talk how DDD are addressing the situation. As a humanitarian actor operating in crisis settings, DDD did preventive through strengthening protective factor, safe access to healthcare, protection, mental health, psychosocial support, awareness raising activities. We know that no single organization can address a complex crisis alone. That's why we work close collaboration with main actors like Green Crescent, with other local communities and governmental to ensure a coordinated and effective response. Of course, staff capacity building training is very important also. We are committed to providing our staff with training and support they need to deliver effective humanitarian aid. And we collaborate such as capacity building program that help them develop the skills and knowledge they need to work in challenging environment. And I want to explain the one of our pictures with one of our beneficiaries, Afghan drug addicted refugees in Manisa unofficial camp, fleeing war and hardship, and 7 members of Afghan refugees family arrived in Manisa, Turkey in 2015. Mr. G, the husband, battle of 5-year addiction that strained their life. Domestic violence and financial struggles became their reality. And maybe we can say hope arrived with DDD. We are visiting officially and with protocols, and we visited these camps, one of these camps. We found this Mr. G, and we provided support for him and his wife and their family. Recognizing Mr. G's addiction, we connect him with mental health professionals, mental health governmental hospitals for treatment. By collaborating with Allo 191, Turkey's anti-drug support line, we ensured this case received priority. With dedication and therapy, Mr. G conquered his addiction. We further empowered him by helping him securing a job through the Turkish Employment İşkur agency. Even now, the DDD psychologists, clinical psychologists continue to offer support, ensuring a lasting positive transformation for Mr. G and his family. This story highlighted the effectiveness of our holistic approach maybe in supporting refugee. Through the addiction treatment, family support and job placement, Mr. G and his family are rebuilding their safe and stable life. And this is one of the example. And our recommendation, recognizing of the preventive role of the actors operating in humanitarian sectors and humanitarian aid context. Addiction should be seen as one of the prioritized issues in humanitarian settings. Main actor operating in addiction field should collaborate with humanitarian actors to enhance the responsibility quality, of course. And the donors should commit a specific budget for an addiction-related response in humanitarian settings. And thank you for attention. Hope it will be at least to opening the floor one first entry. And thank you for listening to me.
Thank you very much, dear Aslı. It was very good. So now let's continue with Anja Bus from the UNODC Prevention and Treatment and Rehabilitation section. Thank you, Anja. The floor is yours.
Thank you. Thank you so much. And as I bring up my slides, really also would like to thank Aslı, the previous speaker, for the excellent presentation. And I mean, I'm really amazed how you're, paying attention to substance use in such difficult situations. I mean, really amazing, and would love to talk afterwards more about the work you're doing. Anyhow, so on behalf of UNODC, we're very happy to join this event and maybe share a few words and slides with you on this important topic of addressing substance use disorders in crisis settings and situations of displacement. So, zooming out a bit to the global situation, as many of you joining here will know, right, that we're estimating around 108 million people worldwide forcibly displaced and counting, and more than 300 million people of need and humanitarian assistance, and also here and counting, right? So there has been studies and research to understand better substance use in humanitarian settings or among displaced populations. And what has been documented among displaced populations is, for example, use of substances such as alcohol, khat, opiates and cannabis, but also kind of ATS, glue and inhalants. And these patterns, of course, differ very much kind of where the assessment was done. And also kind of there was a review on prevalence rates, also prevalence rates very widely. I mean, there seems to be a notion that prevalence rates of displaced populations become similar or are similar to that of the host population at some point. But definitely we need to understand this overall much better. So again, also thanks to the previous speaker for the attention, for the focus groups you're doing to look into this. There are a few unique features of substance use and related harm to consider in displaced populations or humanitarian emergencies. One can be kind of the sudden interruption in the patterns of use or a discontinuity of treatment, right? Which can, among others, lead to some life-threatening conditions, such as maybe withdrawal, for example, from alcohol, or kind of if people then take up substance use again after a while, there could be the risk of overdose due to the reduced tolerance in the meanwhile. So there are certain features to really consider, especially when offering services or paying attention to the needs of vulnerable populations with substance use disorders in these settings. Wait a second now. I think also happened with my slides. Yeah, they're still moving. And I mean, not only basic health and social services are lacking, but also there is, and this again has been documented, very, very limited access to services for substance use disorders in conflict-affected populations. So there has, from the Interagency Standing Committee and the mental health and psychosocial support groups in that document here, there has been also guidance on how to address or to minimize harms related to alcohol and substance use. And the recommendations include to do screening and brief interventions, to provide additional supports, a wide range of them, to also reduce the harms related to substance use, right, which could be different, as you see there. So this could be medications like naloxone, which is an emergency medication in the case of opioid overdose. And I mean, the entire harm reduction package would be important here. But then also, you know, like you said, there is a need to train and supervise health workers, and as possible, kind of for people who are in settings with opioid use disorders, to reestablish opioid agonist treatment. So together with the mental health, well, a subgroup of the mental health and psychosocial support group of the Interagency Standing Committee, which is led by UNHCR, WHO, and now UNODC, a group kind of humanitarian actors is coming together and is developing these training materials, which are existing on different levels to address substance use disorders in humanitarian settings. So there will be one very basic level addressed to community workers, then kind of, let's say, the basic plus level, which will be addressed to really health and social service oriented community workers. And then the advanced level of intervention will more or less go in the direction of tools like the WHO MHGAP toolkit. So just want to point this out to you, and this should be soon available. And there might also be opportunities for field testing or translating these training materials. So I thought that might be relevant to some of you. And also, as UNODC, together with UNHCR and in coordination with WHO, we are preparing further technical guidance. A handbook should be coming, wait for it, on this topic, and I'll just give you a few thoughts from this handbook. One kind of the recommendations will be that at very, very basic minimum to include people with substance use disorders. I think there is a microphone open somewhere, no? Thank you. To at minimum include people with substance use disorders and other kind of health and social supports available to people in humanitarian situations or displaced populations, and not leave them behind for stigma or other reasons. And another recommendation we will make there is kind of that in acute emergencies, there obviously also for people with substance use disorders needs to be attention on saving lives first, right, which would be around addressing life-saving, life-threatening conditions associated with substance use. For example, as I mentioned, alcohol withdrawal could be, or overdose. This I will not go into much detail, just to say that in this handbook, we will differentiate between acute and protracted phase, and kind of maybe the different stages of a response, and detail out what could be done there. Also for that handbook, as it's coming, you know, we will happily kind of have some peer review or support in fine-tuning this handbook. And I'm closing kind of just with a few examples from UNODC and how we are working in these settings. So for example, this is now already a while ago, in 2018, we did a rapid assessment of substance use in a refugee camp in Uganda, north of Kampala. And among other things was found also these patterns of substance use existing around alcohol, cannabis, cut, tobacco, and then in the urban settings, less so in the refugee camp settings, also heroin and cocaine use, including injecting drug use, was identified. And we had based this assessment very much on a tool that's available and was developed by UNHCR and the World Health Organization on how to do rapid assessments in such contexts. Maybe also just to share that, for example, in Ukraine, UNODC continues with some work we have started before the war started around overdose management in emergency settings. So we are continuing with trainings how to provide this life-saving support. We also just recently in the last year trained a number of humanitarian workers that are working at the border between Ecuador and Colombia, especially on interventions such as screening and brief interventions, as they are working with people in human mobility, as it's called there. And UNODC continues to work with partners such as WHO in Afghanistan to provide substance use treatment, support the services that are there, diversify the existing services there in the middle of a situation of dire humanitarian or needs. So I think we are coming to a conclusion very similar also to what Asli said in her recommendations at the end, that I very much agree with. We would also really be arguing to moving beyond asking whether it's feasible to provide substance use services to displaced populations, and rather begin to promote their adoption as essential components of humanitarian responses. So with that, I would also like to invite you, if you can, and especially those that are on site, there will be, you can screen the code here. There will be also an event organized by UNHCR together with UNODC and other partners this afternoon at 1:30 Vienna time on addressing substance use and health risks and displaced populations. And you're all very, very much invited to that as well. And with that, thank you so much. Here's just my contact details again, and I really hope to stay in contact with all of you on the call. It's such an important topic and so many important lessons to share and to learn from everybody speaking today. Thank you so much.
Thank you very much, dear Anja, for your fruitful presentation. Now let's continue with psychologist İrem Atsever from Turkish Green Crescent.
Thank you. Hello, everyone. Good morning. It's a great honor to be part of this event on behalf of the Turkish Green Crescent. Let me introduce myself a little bit. I'm İrem Atsever, and I have worked as a clinical psychologist at Green Crescent Counseling Center. And today I would like to talk about substance abuse disorder and disasters. And now I'm trying to share my screen. Can you see my slides?
Yes, we can see.
Okay, thank you. Thank you for attention in advance. I will start my presentation with our YEDAM model and our services. YEDAM stands for Green Crescent Counseling Center. And we specialized in addiction treatment, actually. And here is the rehabilitation team, our rehabilitation team. And all our centers has at least 2 clinical psychologists, a social worker, and a public relations specialist. We have applied biopsychosocial intervention, actually, and we will evaluate our clients' situation in terms of medical needs, and we refer for detoxification and medical treatment for psychological problems if it's necessary. And our practices are mainly based on psychological and social interventions with psychotherapies and social support services. YEDAM workshops are open for our clients, and it's a part of a social integration, actually. YEDAM workshop aims to improve the professional competencies of the clients and to make them productive by ensuring their social adaptation. And currently, graphic design, social and sport and health life, handcraft, gastronomy, planting and painting workshops are available in our center. And Green Crescent counseling centers are all over the Turkey and Turkish Republic of Northern Cyprus. And appointments are only available through our support hotline 115. And now we have come to studies on substance use disorder and disasters. What do studies say? Firstly, the study showed that burden of PTSD among persons exposed to disasters are really substantial, and diagnosing PTSD was based on the DSM criteria for the study. And study says that post-disasters PTSD is associated with a range of correlates, including social demographic and background factors, event exposure characteristics, social support factors, and personality traits. And for another study, they have conducted study after a flood, and the results say that event-related post-traumatic stress disorder was diagnosed in 22% and 16 at index and follow-up respectively, and virtually no substance abuse followed the flood, and hence substance use did not develop in response to the disaster or as a part of coping with its aftermath. It's surprising, I guess. And for another study, results shows us while the post-disaster prevalence of alcohol use disorders was 19%, and only 0.3% of the sample developed an acute new post-disaster alcohol use disorder after disasters. And most of those in recovery, however, consumed alcohol after the disaster and cope with their emotions by drinking alcohol. And now the researcher of this study conduct a study based on internet-based intervention after a disaster, and the study presents that early interventions that reduce the social burden of mental health problems in the aftermath of disasters have the potential to be enormously valuable, and internet-based interventions can be delivered widely, efficiently, and at low cost. And as such are of particular interest, and findings shows us participants were sufficiently engaged with model content to benefit at the level of psychoeducation, and satisfaction from participants was high. And when it comes to our taking actions after Turkey earthquakes at 2023. Firstly, we organized as a team, and YEDAM had has a lot of study groups focused on different specific topic. And trauma study group is the one of group for this study. And I am a member of this study group, and I also proud of my team. Because after earthquake, the study group prepared necessary materials to put them into services immediately. It includes a psychosocial support hotline guideline and psychosocial support guideline for face-to-face and online sections, psychosocial support presentations for individuals who affected by the earthquakes, and prepared information leaflets. We also received some trainings from external institutions like disorder related to field orientation and psychological trauma, brief trauma interventions, psychosocial interventions in disaster management, and also we received regular supervisions in addition to peer supervisions. We were aware of the necessity of new YEDAM centers in two locations, Hatay and Adıyaman, because our buildings in these two locations were completely destroyed by the earthquake. And soon after the disaster, we opened these two centers because of that. And both YEDAM centers include interview rooms, a workshop room, and separate places to accommodation for YEDAM professional, because our co-workers were not from this region actually. They were working at other YEDAM center, except from this disaster area. And staff was selected among our colleagues who were voluntary to take charge in. Many thanks to our voluntary colleagues actually. And the professional teams were changed by 2 weeks rotations to protect our staff. And now we have some short-term and long-term services after the earthquake. And I can basically divide our services for supporting the earthquake victims and our clients' dependency treatment. And first of all, for services for supporting the earthquake victims, as I said before, we prepared a support hotline guideline, and it was prepared within 2 days after the earthquakes occurred by trauma study group of YEDAM. And 65 specialists gave support to individuals after the hotline training for free. And our objectives were psychological first aids, including action principles for acute phase, look, listen, and link. We determined conditions to make face-to-face and online appointments. Face-to-face and online sections are averagely 7 sessions individuals intervention program, and face-to-face and online versions were available. And here our objectives were psychoeducation about trauma, including understanding trauma reactions, coping strategies with symptoms-related traumatic events, working on grief, and building a new routine, and referring for other services if necessary. We prepared also a presentation for individuals who affected by the earthquakes as a single group studies. And locations were 11 cities affected by the disasters, or other cities at the temporary settlement places such as hotels or dormitories. And here our objectives were psychoeducation about trauma, and again consists trauma reactions, self-help, helping others, and informing about organizations or institutions for available supports. And we also continue for services for our clients' dependency treatments. We met our clients' treatment settings to continue their process and to provide with reaching their treatment goal. transferring our clients to other YEDAM centers, except locations were affected by the earthquakes. And after the container YEDAMs opened, we could provide services there also. And services for new applications soon after the earthquakes, again including treatment setting, our clients' treatment setting to perform a psychosocial intervention. And we transfer new applications to other YEDAM centers for other locations. And also YEDAM centers, after YEDAM centers opened, we could provide services there. You can see some data from our psychosocial supports, and it's really impressive that our number of our received call. And here also some data from addiction treatment in 11 cities affected by the earthquake. The number of publicity and collaboration activities is higher than other services. And other departments of Green Crescent also supported children with different activities, as you can see. And finally, my club is Green Crescent activities continued during this disaster with activity track for children. That's the end of my presentation. Thank you for attention.
Thank you very much, dear Irem, for your great presentation. So now let's continue with Yevgenia Kononchuk from the Eurasian Harm Reduction Association. Yevgenia, the floor is yours.
Yeah, thank you very much.
Morning.
Hello, everyone.
Hello.
Give me a second. I'll try
Yes,
to.
yes, no problem. Take your time.
Can you please help me with this presentation, because as I see, my laptop needs something. So
You want me to share your presentation?
Yeah.
Okay.
If it's a problem with you, I will be really grateful.
If you have troubles, I will do it for you.
Yeah, thank you very much.
No problem. Welcome.
So dear colleagues, hi, good morning. I'm really happy to be with you. My name is Yevgenia Kononchuk. I'm representing here Eurasian Harm Reduction Association, and thank you for this opportunity to present the transformation of harm reduction program in Ukraine during the last 2 years that have already passed since Russia's full-scale invasion. As many of you know, prior to these harm reduction programs in Ukraine, was one of the most developed in our region, despite the relatively large number of clients and a lot of institutional challenges. Almost 70% of people who use drugs were clients of those programs, and it's really good result. Since February 2024, everything dramatically changed in Ukraine. I'm sure that every of you know about the huge mass of people who flies out of their home, who became refugees or internally displaced people. More than 1,000 of medical institutions are damaged and continue to be destroyed every day by the shellings. And actually the last shellings ended just a couple of hours ago, and I'm really lucky to be here with you alive. The destruction of critical medical infrastructure, occupation and potential danger of shellings, regardless of location, have tragically complicated and put harm reduction programs at risk of failure. Colonization and imperialism of drug policy from Russia on occupied territories are leading to war crimes such as...
Yevgenia, you can see the screen. You have started the presentation, or it's just the introductory part?
Can you please switch to... Yeah, I see the presentation, but I can take control of it. So if...
Okay, so I was waiting for your introduction. So now we can continue. Sorry.
Yeah. So please, next slide.
Okay. Sorry. Yes. It will be better if you can watch the slide and tell me to turn.
Sure.
So we are in which slide? This one?
Next one.
Next one. Okay. This one.
Yeah. Thank you very much.
Okay. Sorry for.
Yeah, it's okay. It's okay. Thank you for your help. So colonization and imperialism of drug policy from Russia on occupied territories are leading to war crimes, such as the preventing people of essential treatments, such as OST, imprisonment for long terms, for not even using drugs, but having recipes for OST, and this is a huge problem for Ukrainian partly occupied territories. Next slide, please.
Next slide, okay. Yeah.
But at the same time, those situation united Ukrainian stakeholders, launching the transformation and adaptation of the harm reduction programs. And now I'm really happy to say that despite all difficulties, harm reduction works in Ukraine, and this is a great success and great victory to all activists and organizations. Actually, harm reduction organizations support the community of people who use drugs and Ukrainian people who had flew from war or lost home in 3 directions by continuing their services, by continuing state support and creating temporary shelters. Next slide, please. One example of transformational changes and integration of harm reduction programs component into emergency intervention was harm reduction program in shelters, and integration of harm reduction programs component in ordinary shelters, not shelters for key population or people who use drugs, but just ordinary shelters. Comprehensive harm reduction, enabling evacuation, accommodation of families, food, transport, basic medicine, basic psychology and mental health support have been integrated into the work of dozens of those shelters, thanks to the support of international partners. The following services was available in those shelters, and this is social workers, GBV, health services. Sometimes it was generators full, because as you know, Ukraine still working with massive blackouts. Sometimes it was rape kits, and sometimes it was naloxone, harm reduction materials, OAT, ART, whatever was needed. Next slide, please. Thanks to the incredible effort of Ukrainian partners, the work of harm reduction programs was significantly stabilized by the end of 2022. Of course, most of the programs have lost government funding, and this is a huge problem for Ukraine for the next years. Many territories remain under Russian occupation. The client on those territories cannot access program. However, according to the Public Health Center of Ukraine, at the beginning of 2023, harm reduction programs have almost regained the coverage level that had before the full-scale invasion. The next slide, please. The situation with the OST program is almost the same. OET program, sorry. Before the full-scale invasion, those program in Ukraine was one of the largest in our region, in our EEK region. The program suffered during those 2 years, similar difficulties, but by the beginning of 2023, it was able to almost restore its coverage fully. I would like also to draw your attention to several innovations that have helped transform and adapt OET programs. Please, new slide, next slide. And those innovation, next slide, and those innovation is introduction of new drugs for OAT, including piloting a long-lasting buprenorphine, video counseling of patient by narcologist, HCV treatment at OET sites, take-home options for OET, mental health support at OET sites, and burnout prevention to addiction doctors, nurses, and social workers. Next slide, please. However, at the same time, some of the wartime challenges remain unaddressed, unfortunately. Thus, according to the EHRA study conducted in 2023, there's an urgent need of integration of mental health services and addiction treatment with harm reduction programs for optimal access to mental health care for people who use drugs, especially for NST and stimulant users. I know that there is a lot of pilot in Ukraine on this topic now, but I'm not sure that it might be scaled up in the nearest future because of the lack of the funding. Still, unfortunately. Next slide, please. And next slide, please. Nevertheless, hostilities do not stop and shellings do not stop, and despite a number of successful transformation in Ukraine, there are still quite a few complexes and problems that need to be resolved and addressed. And I'm talking about emergency harm reduction, access to medical aid, accommodation, social care and employment, IRT and TB treatment access, OET access. The need is unpredictable, unfortunately, and could be much bigger than the national program's capacity, especially if we're talking about state funding for those programs. Specialized shelters and support to key population in receiving countries. Unfortunately, it's still a big problem for Ukrainian refugees outside of Ukraine. Despite all great programs for them outside of Ukraine. The next one is mental health and gender-based violence. Comprehensive response is still on the work. And the last one is harm reduction and mental health care for stimulant and NPS users. Next slide, please. Despite all these difficulties in work of harm reduction programs, civil society organizations were able to do some work on advocating for adoption of new national drug policy strategy. They actually created the drug policy coalition established by civil society organization and launched a broad advocacy campaign aimed at adopting a national strategy that would meet the qualification criteria for Ukrainian success to EU, emphasize the commitment to strengthen institutional legal norm to ensure democracy and human rights. This work is still on the process, and I really hope that my partners in Ukraine will have some success in this direction, because it might be really crucial for Ukraine and for Ukrainian drug policy. And the last slide. In closing, I would like to emphasize that experience of Ukrainian harm reduction programs that is still forming is unique, and I'm sure that it can be useful for other countries in the emergency phase. I would also like to express my deep respect to all activists and health workers in Ukraine who continue to work despite shellings. They're actually the only one who made it possible, all our programs here in Ukraine, and their work is truly heroic. So thank you for your time.
Thank you very much, dear Yevgenia. Thank you for your presentation. So I will just... Yes. So now we have George from Slum Child Foundation, but I cannot see him. George, if you are here, we can have your presentation, but I think he might have some emergency. So if you want, we can continue with we have some minutes left for question and answer. We can continue for some questions if you have. Is there someone who wants to ask a question? You can, I'm not sure, you can raise your hands. But if someone have a question, you can open your microphone. Ah, yes, I see a hand. Yes. Yes, Peter, I will open your microphone. Yes.
Now it should work. Thank you very
Yes.
much. So no, I have no question. Just a big thank you for the presenters, as I'm really impressed by the work, because we know substance use issues in crisis settings are not well addressed almost everywhere, even in higher income settings.
Sorry, you can open your camera if you want.
Okay.
If you want, it's
Here I am. Here I am. So no, and it's so good to see that things are happening. Sometimes you get a bit demotivated if you see all the needs and the things. And what was so good here, these were not just theoretical presentations. There were some concrete examples of what can be done. And I think it's really important. And I'm working in UNHCR, refugee agency. We don't do enough, honestly. But I'm trying internally to get organizations to do more. And I know Anja in UNODC is pushing for UNODC to do more in humanitarian settings. So we need to connect. And of course, the organizations that we're presenting here actually are quite ahead of others. So that's the only thing I wanted to say. So let's continue the conversation.
Thank you very much. We are open to collaborate because, yes, it's an important issue. And we as actors working in humanitarian fields, we see this problem, and we are open to collaborate with organizations like you. Thank you very much for your comments. If there is another comment or another question, you can raise your hand. Or you can even write in the chat box section. If there is no question, we will close slowly because we are in the time. It's the time to close. So if you want, speakers can open their camera if you want, but as you want, for a small picture. Yes. Yes, it will be good for a small picture. Thank you very much. Aslı, you are here? Yes. Thank you very much. I'm taking a small picture.
I'm just realizing it has been a very female-led event.
Yes,
I
yes.
know, right?
I just
George
realized
make it.
we will have George, but unfortunately, he was unable to come.
No, but I mean, really, thanks for that. And I think, you got a lot of praise in the chat. And I think it would be really great to somehow stay connected, start sharing presentations, maybe follow up afterwards.
Yes,
there's so much to be learned
we,
from all of your work. And thank you.
We would like. Thank you very much to come this morning. And thank you very much also to all the attendees that connect in this morning. Thank you very much. Thank you very much.
Thank you, Aysun, and thank you, everyone.
Thank you. Thank you.
Bye
Hope
bye.
to cross
Take
again.
care.
Bye. Take care.
And if you can join us this afternoon, 1:30, right?
Yes.
For the UNHCR event.
Yes.
Bye-bye.
1:30. Thank you very much.
I added a link in the chat again, and otherwise write me so we can share it. Yeah.
Okay. I will check in the text section. Thank you very much.